Good morning, Mrs. Lee. I understand you've been experiencing some abdominal pain. Can you describe your symptoms?
当然可以，我右上腹有很剧烈的疼痛，特别是吃完油腻的食物之后，有时候疼痛会传到背部和右边肩膀。
Have you experienced nausea, vomiting, or any changes in your bowel movements?
有，我经常觉得很反胃，有时候还会吐。最近我发现大便的颜色比平时更浅了。
Do you notice you have jaundice?
什么意思？
Jaundice is a condition where your skin and the whites of your eyes turn yellow. It happens when there's too much bilirubin, a yellow pigment, in your bloodstream. This can occur if a gallstone blocks the bile duct, preventing bile from draining properly from the liver.
没有啊，我没有发现皮肤或者眼白变黄，但我发现尿液比平时变深了。
These symptoms suggest a possible issue with your gallbladder. Have you had any imaging studies done, such as an ultrasound or CT scan?
有，我的家庭医生帮我安排了腹部超声波检查，他们说我有胆结石。
Let me take a look at your chart. Gallstones can block the bile ducts and cause inflammation, a condition known as cholecystitis. This can lead to severe pain and digestive issues. The most effective treatment for symptomatic gallstones is a cholecystectomy, which is the surgical removal of the gallbladder.
手术是唯一选择吗？有没有药物可以溶解胆结石？
While there are some medications, they work slowly and are only effective for small cholesterol-based stones. However, they don't prevent new stones from forming.
我可以试试你刚才说的那种药吗？对我有效吗？如果我不切除胆囊会怎么样？
Your stone is not small, cholesterol-based gallstones. You have multiple pigment stones and calcified stones. Medication alone is unlikely to provide lasting relief. That's why cholecystectomy is usually the recommended treatment for symptomatic gallstones. If left untreated, gallstones can cause repeated episodes of biliary colic, acute cholecystitis, or even gallstone pancreatitis if a stone blocks the pancreatic duct.
我需要做什么类型的手术？
We typically perform a laparoscopic cholecystectomy, which is minimally invasive. It involves making small incisions and using a camera to guide the removal of the gallbladder. It is so much better than open surgery. It results in less post-operative pain, shorter hospital stays, quicker recovery, and minimal scarring compared to an open cholecystectomy.
为什么我不能只做胆结石清除手术？为什么要切除整个胆囊？
Gallstones tend to recur even if we remove them. The gallbladder itself may not function properly anymore, leading to continued issues like inflammation or bile duct obstruction. Removing the entire gallbladder prevents future complications and ensures that the problem doesn't come back.
没有了胆囊会不会影响将来的生活？
Most people can live a normal life without a gallbladder. Your liver will still produce bile, but instead of being stored in the gallbladder, it will flow directly into your small intestine. Some people may experience mild digestive changes, like occasional diarrhea, especially after eating fatty foods. However, your body usually adapts over time, and most patients don't have long-term issues.
没有了胆囊之后，我需要遵循特定的饮食吗？
There isn't a strict diet you must follow, but you may need to make some adjustments, especially in the first few weeks after surgery. Since bile will flow directly into your small intestine without being stored, your body may have a harder time digesting fatty, greasy, or fried foods. I recommend starting with a low-fat diet, eating smaller, more frequent meals, and gradually reintroducing foods to see how your body reacts. Most people adapt over time and can eat a normal diet without major restrictions.
如果我将来怀孕，这个手术会不会有影响？
No, but pregnancy can sometimes increase the risk of gallstone formation due to hormonal changes. Since your gallbladder is removed, that won't be a concern.
胆结石会不会遗传？
Yes, genetics can play a role in the development of gallstones. If you have a family history of gallstones, you may have a higher risk of developing them. Other risk factors include obesity, a high-fat diet, rapid weight loss, certain medical conditions like diabetes, and hormonal factors such as pregnancy or hormone therapy. While genetics can increase your risk, lifestyle choices also play a significant role in gallstone formation.
我将来的小孩有多大机会会得胆结石？我是不是不应该生小孩？
While genetics can increase the risk of gallstones, it does not guarantee that your child will develop them. Other factors, such as diet, lifestyle, and overall health, play a much bigger role. Pregnancy itself can increase the risk of gallstones due to hormonal changes, but it is not a reason to avoid having children. If you are concerned, maintaining a healthy diet, staying active, and managing weight can help reduce the risk for both you and your future child.
这个手术有没有风险或者并发症？
As with any surgery, there are risks, including bleeding, infection, injury to the bile duct, or bile leak. In rare cases, a patient may develop post-cholecystectomy syndrome, causing persistent digestive issues.
什么是胆汁渗漏？
A bile leak occurs if bile spills from the cystic duct stump or bile ducts after surgery. It can cause abdominal pain, fever, and require additional intervention.
手术大概需要多长时间？
A laparoscopic cholecystectomy usually takes about 45 minutes to an hour. However, if complications arise, it may take longer.
是不是全身麻醉？
Yes, you'll be under general anesthesia, meaning you will be completely unconscious during the procedure.
我要住院多久？
Most patients go home the same day, but if we need to perform an open cholecystectomy, you may need to stay for 1 or 2 nights.
是什么原因会导致胆结石？
Gallstones form when there is an imbalance in the substances that make up bile, such as cholesterol, bile salts, and bilirubin. This can cause bile to become oversaturated, leading to crystal formation, which eventually turns into stones. Common risk factors include a high fat, high cholesterol diet, obesity, rapid weight loss, diabetes, pregnancy, hormonal changes, and family history. Certain medications and a long-term low-fiber diet can also increase the risk of developing gallstones.
可不可以用激光把胆结石打碎？为什么不能用这个方法？
Unfortunately, laser treatment is not an effective method for breaking down gallstones. Unlike kidney stones, which can sometimes be broken up using shockwave lithotripsy, gallstones are different because they form in the gallbladder, where they can easily recur. Even if we could break them down, the fragments might still block the bile ducts, leading to complications. That's why removing the gallbladder is the best long-term solution for preventing future problems.
我这个情况有多紧急？我要多快做手术？是不是一定要马上切除胆囊？
If you're only experiencing mild symptoms occasionally, the surgery may not need to be done immediately, but I wouldn't recommend delaying it for too long. Gallstones can suddenly lead to acute cholecystitis or bile duct obstruction, which can make the situation much more serious. If you're already having persistent abdominal pain, fever, nausea, vomiting, or even jaundice, then you may need urgent treatment and possibly immediate surgery. So, I recommend scheduling the procedure as soon as possible to prevent complications.
我不想再拖了，尽快做手术吧。这个手术安全吗？
A laparoscopic cholecystectomy is a very common and generally safe procedure. The risk of major complications is low, especially when performed by an experienced surgeon. However, as I mentioned earlier, as with any surgery, there are some risks, including bleeding, infection, injury to the bile duct, or bile leakage. Serious complications are rare, and most patients recover without issues. We will take all necessary precautions to ensure the safest outcome for you.
我们什么时候可以安排手术？
We can schedule it within the next week or two, depending on availability. I'll have my staff coordinate with you.
谢谢医生。